Acute AC joint disruption is caused by direct impact to the shoulder. It is commonly seen after falls, contact sports, or road traffic accidents. It may also be caused by indirect trauma, such as a fall on an outstretched arm. The AUXFix button is a titanium implant designed for AC joint reduction. Multiple slotted holes allow the use of several suture tapes for secure fixation. It delivers strong compression across the clavicles to stabilize the AC joint. The suture material passes through tunnels, minimizing bone loss during the procedure. Position the patient in the beach chair position. Prepare the surgical site and insert protein and rigid cannulas. Assemble the AC joint hammer guide with retro drill guide handle and 2.4 mm AC joint guide pin sleeve. Position the hammer head on the coracoid, 10 mm distal to joint space. Open the jig up to 90 degrees based on the anatomy. Position the AC joint guide pin sleeve on the clavicle bone. Insert 1.5 mm K-wire through guide pin sleeve and confirm under fluoroscopy. Retrieve 2.4 mm guide pin sleeve and 1.5 mm K-wire. Position 3.5 mm AC joint guide pin sleeve. Use 3.5 mm drill bit through the sleeve. Drill until the far cortex of coracoid is breached. Open jig and release the guide pin sleeve. Retrieve jig completely from the joint space. Unscrew and remove the pin from the 3.5 mm drill bit. Introduce the nitinol wire into the joint space through 3.5 mm drill bit. Retrieve nitinol wire using suture retriever from low anterior portal. Remove the 3.5 mm drill bit. Load 2 mm suture tape on AUXFix button and create a loop. Load suture tape ends onto the nitinol wire. Retrieve nitinol wire to pull AUXFix suture tape loop superiorly. Pull suture tape to seat AUXFix button on the inferior surface of coracoid. Load second AUXFix button on suture tape. Seat the second AUXFix button on the clavicle. Pull suture tapes to induce compression. Tie knot once adequate compression is achieved. Use a knot pusher to hold the desired reduction. Cut access suture tapes. AC joint surgery completed using Auxion's AUXFix button. The shoulder is immobilized in a sling to protect the repair during early healing. Gentle passive and assisted range of motion exercises are started as advised. Heavy lifting, overhead activity, and contact sports are avoided until healing is complete. Gradual strengthening and physiotherapy help restore shoulder stability and function.